we have to get rid of the upper fermenting gut. And yes, there's a two-pronged approach. Yes, we starve them out with a low-carb ketogenic diet. And secondly, we kill them. And there are 3 fantastic tools which are available to everybody. They're very inexpensive and they do lots of other good things for the body as well. The first of those is vitamin C. It's vitamin C, contact kills all microbes. Humans cannot make their own vitamin C. Humans, fruit bats, and guinea pigs cannot make their own vitamin C. It's I beg your pardon. Dry-nosed primates and guinea pigs cannot make their own vitamin C. Linus Pauling, who's the only guy to win 2 Nobel Prizes in his own right, and was only beaten to a third by Watson and Crick. He calculated from what animals produce that humans should have about 5.7 grams of vitamin C a day. So everybody should take 5 grams of vitamin C. That's about a rounded teaspoonful. Ascorbic acid is very cheap. In a glass of warm water, it dissolves very easily, and that should be your first drink of the day. Down the hatch in one fell swoop, because the stomach is empty. If there are any bacteria or yeast there, then lining the gut, then the vitamin C will hit them in a high dose, and that will reduce the contamination with those. The second thing is iodine. Again, iodine is one of my favorite multitasking tools. Again, it contact kills all microbes. You should separate vitamin C and iodine. Don't take them at the same time because one is a reducing agent, the other is an oxidizing agent. I can never remember which way round it is, but it doesn't matter. The important point is take them separately. So I do mine midday, 3 drops of Lugol's iodine, 15% in a glass of water. Again, that contact kills all microbes. And the third intervention, which is very helpful, is methyl sulfonyl methane, MSM. Again, it's as cheap as chips. It's fast becoming one of my favorite multitasking tools because we're all sulfur deficient, and sulfur is essential for fourth phase water, which is the subject of another long lecture. It's essential for the gut for healing and repair. It's essential for connective tissue. It's very good at detoxing heavy metals. But it has the very desirable property in the upper gut, which is aerobic, it's oxygenated, it kills microbes. But in the lower gut, which is anaerobic, it feeds them, it acts as a prebiotic. So it's very cheap, it's very safe, it's multitasking, and it's a great treatment for the gut. So those are the 3 ways by which we sort out the upper fermenting gut.
Okay, before we move forward, let me get into each of these. I have follow-up questions to make sure I'm totally clear. So the vitamin C, you recommend having that all in one bolus rather than spreading that out?
I do, because the interventions I suggest for my patients have got to be cheap, effective, and sustainable. We've got to be able to do them in a frictionless way. If it's difficult, it's a bottle and a little bit here and a little bit there, it's not going to happen. Now, I decided to test myself because we're taught at medical school, there's no point taking vitamin C. You drink it one day and in 1 hour and it's gone a few hours later. So I stopped taking vitamin C, but I tested my urine every day to see if I was still peeing out vitamin C. Now, you can get these sticks very cheaply from Amazon for less than, you can get 100 sticks for less than a tenner, very cheap. And the ascorbic acid portion should go from a sort of green colour to a yellow colour. That means you're peeing out ascorbic acid. I continued to excrete ascorbic acid for 5 days. So that tells me it is quite well stored in the system, and it takes a long time to deplete. So that was the first thing that encouraged me to take it in one fell swoop. The second thing is, by taking it in one fell swoop on an empty stomach, you're going to have the best effect on any bacteria and yeast that may be there. Because in the morning when you wake up, the stomach is empty. So you're going to get a high concentration of ascorbic acid in the stomach, which is where it all happens, or much of it happens, killing those bacteria and yeast when they're at their most vulnerable, i.e., the stomach is empty. So, yes, I recommend taking it in one fell swoop.
And it sounds like you're just dumping powder into a cup and drinking it back. How do you feel about capsules?
Oh, that's fine. It's cheaper to have do it in warm water. And the other good thing is if that bacterial and fungal contamination extends into the esophagus, which it may well do, you're giving the esophagus a nice coating of ascorbic acid as well. The only thing to bear in mind is as soon as you've done that, rinse your mouth out, or brush your teeth, because you don't want acid sitting on your dental enamel, because there's potential for it to dissolve that, and you can do without that.
And how do you feel about these food-based vitamin C's? Things like acerola cherry. There's always, well, a lot of times with supplements, you can get a food-based one versus the chemical ascorbic acid. So if somebody were to say, I want the whole food version, I want to take caps or powder of, say, acerola cherry, any problem there?
And that's absolutely fine. But the trouble is, it's more expensive. And, the people, I tend to see many people with fatigue syndromes. People with fatigue syndromes, they can't work. They're counting the pennies. So my interventions I recommend have got to be affordable. So, if you've got lots of dosh and that's not an issue, fine to take those food grade ones. But ascorbic acid, it's biologically identical. It's what's been used for decades. It's very safe. It's efficacious. So I tend to stick with the cheap and cheerful.
And when you talked about the fact that it's going through and doing all this killing, it gets me thinking about our healthy bugs, our healthy biome. Does it preserve that, or is it just there's no healthy bugs in that area?
Exactly. I mean, the top 25 foot of the gut should be sterile or near sterile. The microbiome resides in the last 5 foot of bowel. Now, the point about ascorbic acid is it's going to be absorbed systemically into the bloodstream and excreted in the kidneys. So is iodine. So the ascorbic acid never gets to the microbiome. Now, the only time it gets to the microbiome is if you're taking ascorbic acid to bowel tolerance in the event of an acute cold or an acute fever. And then, yes, you want to take big doses of ascorbic acid in order to get to bowel tolerance very quickly, because then that gets rid of the infection before it gets rid of you. And in that event, some ascorbic acid will trickle into the microbiome and start to kill some of the friendly microbes there, which then get fermented by other friendly microbes, and that gives you rumbling tummy and foul-smelling wind. At that point, you've overdosed, you've taken too much. So then you pull the dose back to a sub-bowel tolerance dose. Everybody's different, and that bowel tolerance will differ in different situations. But and sometimes you will overdo things and you'll get frank diarrhea. But that's why we have an appendix. The appendix is awfully important. I mean, we are told by the surgeons that the appendix is it's a bit of redundant tissue. We don't really need it anymore. And if we hoik it out, don't worry about it. But if you think about the appendix, it's right at the junction of the upper gut, which should be sterile, and the lower gut, which should be full of microbes. So should you get an episode of diarrhea, and of course, guess what? Primitive man would have eaten some rotten meat occasionally, and got sick. He would have eaten the wrong berries and got sick or whatever. But the appendix comes to the rescue, because you might sweep out all those friendly microbes in the microbiome, but the appendix is there at just the right place to re-inoculate the large bowel with the friendly microbes.
Okay, and continuing this out, extrapolating, you mentioned for iodine, one of the purposes at least is to kill. And I think with MSM too, you can clarify. With those two as well, is it the same principle as the vitamin C, where it's not going to affect the healthy bacteria?
Correct, but iodine is so well absorbed from the upper gut, it never gets the large bowel. It's any excess is excreted in urine. And as I mentioned earlier, MSM, yes, it kills the upper gut in the oxygenate environment, but in the microbiome, it feeds. It's a prebiotic in an anaerobic environment. So the point is all these three kill in the upper gut and have no impact, or with the MSM, a beneficial impact in the microbiome.
Okay, let's move into iodine now. This is one that is quite controversial, especially in doses like you're talking about. First of all, why is there so much controversy around taking this?
Medicine in this world is controlled by Big Pharma. Big Pharma's mantra is, a patient cured is a customer lost. Big Pharma wants lots of sick people. The last thing it wants is lots of healthy people taking cheap, effective nutritional supplements. So whenever you find something that works really well, that's cheap, you get all this fake news put out. So, for example, all doctors in this country, when I start talking about ascorbic acid, that's terribly dangerous, it'll give you kidney stones. Rubbish. The opposite. It's the very good treatment for renal stones to prevent them. And it's the same with iodine. They will tell you, oh, you'll send your thyroid overactive. Well, you might temporarily, because we are all iodine deficient, and that is a common driver of the underactive thyroid. So if you have somebody who has a slightly underactive thyroid and you suddenly give them a good dose of iodine, the thyroid says, yippee, we've got some iodine at last, and it goes into overdrive. But the thyroid and the pituitary gland are perfectly intelligent. And it immediately works out, oh, we've gone into overdrive, and it all settles down, within 2 weeks maximum. So with iodine, it's probably a good idea to start low and go slow. And the rules of the game are, the sicker you are, the slower you go. Now, if I had somebody who's otherwise fit and well, I'd say, yeah, fine, just take 3 drops of iodine, you'll be fine. If I had somebody who's really sick, I'd say, oh, no, put 1 drop in a glass of water and have a sip. And if that's okay the next day, have 2 sips, and build it up really slowly. And the same is true of MSM. These cheap, simple, effective naturopathic interventions have the potential to do much good. And in doing much good, you can get a healing crisis. That's what the homeopathic and the naturopathic doctors call it. So, as I say, the sicker you are, the slower you go. And with the MSM, start with just maybe a quarter of a teaspoon and a day and build up slowly. But I like to aim for a window of time of 6 months when you're taking 30 grams of MSM 3 days a week. Now, don't take it all the time, because not only is it's very good at detoxing heavy metals, and yes, it will pull out the heavy metals very nicely, thank you very much, but it will also take out some of the friendlies. So what I like people to do is take it 3 days a week, 30 grams 3 days a week, Monday, Wednesday, Friday, and then the rest of the week, make sure you replenish with all the friendly minerals. So I make up a product called Sunshine Salt, which has got all the minerals that I'm allowed to give in decent doses, in a form that's soluble, and people rescue with that. And of course, it's as cheap as chips. But a good multi-mineral, I'm sure you can buy them in the States, would be ideal.
Okay, we're going to come back to MSM, but I want to come back to iodine first. Any special population, somebody with Hashimoto's thyroid problems, that need to avoid it?
No, they all need it, because it's not just the thyroid gland that needs iodine. Every tissue in the body pretty much has a requirement for iodine. The brain, iodine deficiency is the number 1 cause of mental deficiency in the world today. It's essential for the immune system. Can't function without. Iodine lines mucous membranes in the chest, the nose, the genital tract, and that protects us from infection. It's essential for muscles. We can't sweat without iodine. We need iodine to make the love hormone oxytocin. It's just so important for every department of the body. I will send you my iodine chapter from my thyroid book, which details, the breast, for example. Women who have fibrocystic disease of the breast, you can often cure it just with iodine. Anybody with any cysts, polycystic ovary disease, cystic disease, thyroid cysts, it's often symptomatic of iodine deficiency. In fact, Albert Svensk-Gorzi, who discovered vitamin C, he was a medical student during the 1920s, and there was a little ditty that the medical students used to say, which went, "If ye know not the where and why, prescribe ye then K and I." It was almost a universal panacea. It was such an important medicine.
Okay, so dosage-wise, you want to go slow if this is new to you. We're working up to 3 drops of Lugol's iodine in water, and that's 15%.
Correct. It supplies about 50 milligrams of iodine.
Okay, and if somebody took more than that, say even by accident, put 4 or 5 drops, what does the body do with that? Does it have systems in place to get rid of it?
It just pees it out. That's the joy of it. If you overdose, you just pee it out. And in peeing it out, you keep the urinary tract nice and clean. Because as we know, urinary tract infections are common. And it would be a very good treatment for any woman who's suffering from recurrent cystitis, for example.
Okay, we'll move into MSM now. You've already given us the lay of the land there. The fact we want to take is at 30 grams, 3 days a week, spread out by 1 day in between. Correct?
Correct.
And is there a certain source we're looking for? Is there organic MSM sourced from different things?
Yep. I like to use the organic MSM, which is clean, because there's no point detoxing people if you're putting toxins into the system. It costs about 30 quid for a kilogram, which will last you a jolly long time. So it's a very, very cheap way of treating and detoxing the heavy metals at the same time.
And where do they get that from?
Oh, I get it on Amazon.
No, but like, where do they source it? What is it? Where do they extract it from?
That's a very good question. I'm so ashamed I don't know the answer to that. Somebody asked me that the other day and I never got around to looking it up. But the MSM we're using at the moment is a vegan source. So my guess is it probably comes from a bacterial ferment, but that's only my guess. But I do apologize. I need to look that up.
Okay, and you talked about in between making sure we're upping minerals on those days.
Yeah. And
you mentioned your salt. What other products on the market do you like when it comes to minerals?
Well, because my salt is so cheap, that's what I recommend to everybody, because it can easily be put into the regime because it becomes part of your diet, and it also means you can slip it into the family food, so you can treat the family at the same time without them realizing. But if you check the constituents of my sunshine salt, find a mineral that's got similar amounts of zinc, copper, selenium, molybdenum, chromium, etc., etc., etc. Because I say I've got all the minerals in there that are important.
Okay, so we have the protocol now. When it comes to these 3 supplements, is this ongoing or is it just for a period of time while we're clearing out the upper fermenting gut?
Well, yes. Yeah. But my view is we should take those doses of iodine and those doses of vitamin C for life. The MSM, I recommend a window of time of 6 months when you're taking that high dose, i.e. 30 grams 3 times a week, and then end up with a maintenance dose of maybe half a teaspoon, or a teaspoonful, a couple of times a week, just to maintain the status quo. Because the fact is we're all poisoned. You see, as soon as we started burning fossil fuels and mobilizing coal and oil from the Earth's crust, we're also mobilizing heavy metals, which inevitably get into our soil, into the air, into our water. So whether we like it or not, we are all poisoned by heavy metals. Now, the body can tolerate a certain amount of metal poisoning, but if it gets beyond a certain level, it's going to cause serious pathology. And of course, the wretched doctors and dentists are using these heavy metals all the time, aren't they? I mean, dentists, love to use dental amalgam fillings, so we're all being poisoned by dental amalgam. Aluminium is present in vaccines as an adjuvant, and so we're injecting it into kids, and that cannot be a good thing to do. They're used in cooking, aluminium foil, aluminium cans, aluminium saucepans. It's a disaster. I mean, when I do heavy metal tests, I'm so often seeing barium. Where's that coming from? It's not coming from barium meals. It might be coming from cloud seeding for all we know. I mean, we don't know. But the point is all these heavy metals are getting into the environment and they're going to end up in our bodies. So obviously we do our best to try to avoid them. But the joy of using MSM is we can mobilize them and we can excrete them safely.
If you enjoyed that clip, you're going to want to head over here and catch the full episode. I'll see you over there.
The upper fermenting gut is a major, major problem. It goes almost unrecognized by the conventional doctors. We have to get rid of the upper fermenting gut. And yes, there's a 2-pronged approach. Yes, we starve them out with a low-carb ketogenic diet. And secondly,